Hi, I live in the United States and I am 61 years old, and I'm doing this video clip to help the thousands of people out there who are suffering with gastrointestinal pains or vague pains in the stomach area, pains that they have a hard time describing to others as well as their doctor. This is for people who have doctors that don't know what's wrong. Really, they haven't been able to diagnose it. That can be frightening. So I ended up losing 30 pounds over 7 months simply because I couldn't eat anything without experiencing pain afterwards. I want you to know that I'm not doing this for money and I have no website or pills to sell you. I'm just giving you my experience in hopes that my 7 months of hell will help somebody. I went through 2 GI doctors and 1 naturopath. None found the problem, only I did. I've tagged this to gallbladder problems, irritable bowel syndrome, stomach problems, cancer, liver, candida problems. And, well, the problem that I had was gallbladder stones that were packed in my gallbladder. Now, if you've never had the ultrasound gallbladder test, I do want you to hear my video clip. I'll try to hurry as fast as I can and give you some background. In January of 2012, I started getting these vague pains in my stomach area, so I thought at the time, anyway, I only had experienced it maybe 3 times a month, so I went to my GI doctor, and because I'm into nutrition, I asked him to perform some simple digestion tests that I had read in Dr. Russell Blaylock's book called Health and Nutrition Secrets. This list included a, quote, gallbladder series, upper and lower GI radiological examination, which is a barium swallow or an enema that can give you that result, and possibly an endoscopic examination, both the fore and the aft. He also recommended a complete blood count, a CBC count, a urinalysis, and a comprehensive metabolic analysis, which includes a measure of liver enzymes. I wasn't ever able to get the metabolic analysis, but as it turned out, I didn't need it. So the result of all this, and the reason that he does this, is that today's doctors, their testing is inadequate, quote unquote, and rarely includes functional studies of digestion. So when I asked my doctor to do these tests, he said, quote, "We don't need to do that." I felt stymied, but I went along with what he said. What he said is that it had something to do with age and that the digestive system has problems as we get older. Well, we all know that we have problems as we get older, so I thought maybe he's right. The next month I continued still having some mild problems, about 3 times a month, 4 times a month incidences. So he did a celiac test and that came back negative. He suggested I could take probiotics to help my digestion, so I did. He suggested, again, that it was age-related. But on March 20th, I saw my GI doctor again, and I wasn't happy because my symptoms were not going away. If anything, they had increased in frequency. I'd been losing weight, however, deliberately changing my diet to an organic, healthy one since January, all to no avail. Still, he didn't seem to be alarmed. On April 10th, the pains in frequency and length had started to increase. I continued my research and I wondered if I could possibly have H. pylori, a bacterial infection. So I had a test done. He did it against, his better judgment. He didn't think I had it. Well, at the wedding out of state, I got my results and they were positive. So I thought, well, I have H. pylori. So he wanted to put me on a 10-day gruesome antibiotic program called PrevPack. It's a combination of these antibiotics, PrevPack. But I wanted to start a natural cleanse, so I called BeyondHealth.com, a wonderful place to go for pure vitamins, and I asked what they would recommend. And so after telling me their disclaimer, they said I could try coconut oil and olive leaf extract. So I started on that program. The olive leaf extract, 3 to 4 capsules a day, 3 to 4 teaspoons of coconut oil per day, and the capsules for the olive leaf extract was 3 to 4 capsules about 4 times per day. I also decided to see another doctor in the area. By the time I saw him and had added to my regime GI intestinal powder, enzymes, cat's claw, and a number of other things, I felt pretty overloaded. The last day of the olive leaf extract coconut oil regimen was May 9th. I waited a couple weeks to make sure the next test would be valid results. It was done through Geneva Diagnostics, and on June 4th they came back negative on H. pylori. The day after, I'd already started my Prevpac antibiotic regimen. Now, H. pylori is normal. I do want to say this to some extent. We probably contract it when we're kids. And the reason it never becomes a problem is that the good bacteria overwhelms the bad bacteria. So even though I didn't know at the time that it was gallstones that were the problem, I probably didn't have a problem big enough, with the bacteria, H. pylori, that I probably didn't even need to do anything regarding that. So anyway, I just continued the antibiotics because everybody was recommending me to do that. And in hindsight, I just wished I wouldn't have done that because the antibiotics are not good for our system, as we all know. And the bad news was after all this cleansing and all the antibiotics, the pain never stopped. Talk about anguish and weight loss and fears that I was going to dwindle down to nothing. I want to note here just briefly that all of May, June, and July, I was experiencing pains daily. They were lasting a long time, like 2 to 3 hours to 5 to 7 hours in a day. I was dropping weight, starting to drop weight faster then. By the end of July, I'd lost 30 pounds. I was overweight to begin with, so that was okay, to be now at a normal weight. But even though I'd lost weight, it got to the point of me standing in the middle of the grocery fruit section just crying that day because I didn't know what to eat anymore that wouldn't cause pain. I prayed so hard that day, but I thought rather I knew that if I couldn't find an answer to this, I was going to die, just dwindle away to nothing. During that May time frame, stepping back a little here, I decided to go to a naturopath, more money gone, but at this point, all the supplements and doctor appointments had cost $3,000. Anyway, I went on, because when you feel desperate to stop the pain, you do anything. You read everything. You try everything. The naturopath felt that my system was being overwhelmed with all the vitamins and supplements, so she suspended them for the time being. I was taking L-glutamine, DGL, olive leaf extract, cat's claw, EGCG, GI Revive, and fiber, etc., etc. It was a grocery bag full of vitamins and all kinds of good stuff, I'm sure. But anyway, I had experience coming back from California. One night I threw up green bile. This was during my olive leaf extract deal, and I'm sure it cleansed my system, but boy, that night I thought I was going to die for sure. But I felt immediately well afterwards. And then shortly after that, the regimen was over. But since I was still in pain, she thought I should get an endoscopy. So I scheduled an endoscopy for June 28th through another GI doctor because I'd had it with the first doctor. And the results were he found that I had acid reflux disease or esophageal reflux, and he wanted to prescribe Prilosec, Prilosec, at 20 milligrams per day, Prilosec. I decided against this. I just couldn't do it. I guess I was at that point, just sick of drugs and pills and everything. So I remember asking him, did it cause these vague kind of pains that I was having? And he said it could, that it was possible. But my naturopath doctor thought it was a candida problem, so then she put me on an anti-yeast diet for a couple of weeks, but, I just felt something was wrong. I just didn't think I had a yeast problem. I'd never had a yeast problem in my life. And something she told me that just got to me. I just said, listen, I asked her if she could order an ultrasound gallbladder test just to rule it out because it was one of the things that I hadn't done. And I just thought, well, if I have them, I have them, and whatever. But I didn't think I did, really. I'll never forget that morning. My husband was with me, and the ultrasound technician's first words were, "You've been in a lot of pain for some time, haven't you?" He was very serious. He indicated that he would send the results in, but he hinted I'd need surgery very quick. Well, he was right. The GI doctor that got the results never even scheduled me for an appointment to visit with him. He immediately referred me to a surgeon. So I had my gallbladder removed and all those stones August 8th, and finally the pain went away. So if you think you're having these vague, hard-to-describe pains in your stomach gastrointestinal region, the first thing you should do is have an easy ultrasound done for the gallstones. It's non-invasive, it doesn't hurt, it's on the outside of your skin. And after going through all the hell I went through, I can tell you all this pain could have been avoided 100%. These GI doctors don't know complete digestive system testing. They wait and wait until maybe, and if you're lucky, they stumble onto the right test. Now, I do want to say that by the time I'd gotten through to this point, I figured it out that since it was a gallbladder, it was that my fat wasn't being digested. Well, everything I was eating had some fat in it, including chicken and meat. So I did a simple test for about 4 days because I was scheduled a week out for my surgery, and I ate nothing but fruits and vegetables, no butter, no chicken, no meat, just fish. And I actually steamed the fish. And do you know, I didn't have any pain, not one little bit of pain. And so I did that all the way, lost a few more pounds, of course, but I did all that until I went to have surgery. So that is a real little simple test you can perform just to see if maybe it might be your gallbladder. If you have no pain and your pain goes away when you cut out butter, margarine, oil, and all that, and you just stick straight to all vegetables, all fruits, any kind, and fish that's steamed, and that's it, and you don't have any pain, then you probably do have a gallbladder problem. So I hope this has been helpful to everybody, and I hope I haven't forgotten anything important to tell you, but I think everybody knows that's been through pain, all the research they've done, all the things you've researched, large and small intestinal bacteria overgrowth, irritable bowel syndrome, candida, mercury poisoning, H. pylori, GERD disease, all this. And by the way, I never did take those Prilosec pills for my esophageal reflux because I figured that's probably age and who cares? It's not a bad thing for me. I can sleep at night. So anyway, thank you. I hope this helps, and goodbye.